This Good to Go segment is sponsored by Spectrum Health Medical Group.
November is a time to focus on men's health, including raising awareness about prostate cancer, testicular cancer, and men's mental health in general. Dr. Conrad Tobert is a urologist with Spectrum Health, here to share the most current information about health topics specific to men. Hi, Dr. Tobert.
Hi, Catherine. How are you?
I am well, thank you. I know November, Men's Health Month. It's also called No Shave November, and I see a little something. You're participating, and tell me why.
That's right. I am, trying to grow a beard. As you can see, it may be very faintly visible, but, I'm doing it to raise awareness for men's health. So if patients, see it or comment, they can, I can strike up a conversation about, my desires and my passion for just raising awareness for men's health, and specifically for a couple organizations here in Grand Rapids, Gilda's Club, as well as the West Michigan Prostate Cancer Health Alliance, trying to, again, raise awareness for these important issues.
Yeah, they do a lot of great work. So what are some of the top, couple of health issues that men should be thinking about? And I know they're based on their age, right?
Absolutely. And you kind of touched on, three big ones. And if you break it down by age, younger men specifically, post puberty through 35, testicular cancer is something that is the most common solid tumor for men of that age. So that is an important one. Prostate cancer, many of us have heard about and talk about with different family members. Men in their middle ages, roughly, 40 to 75 is an important one. And then something that you mentioned, just mental health, something that it doesn't have an age component to it. It can affect men of all ages. Those are three really important elements that, really should be taken into account for men's health.
Yeah. For women, we know that at certain ages, there are screenings and tests that we need to be doing. Do men have some of those same kind of benchmarks?
Absolutely, they do. For specifically, the first one we talked about was testicular cancer. We talk and recommend every man does a self testicular exam once a month, and we recommend that from the ages essentially from puberty through 35. And what they should be feeling for is something that feels like the firmness or hardness of a knuckle. A hard lump is something that should not be there. Testicular cancer isn't very common. Less than 1% of all male cancers is testicular cancer, but it is the most common cancer in men between the ages of 20 to 35. So doing a regular screening once a month it should be done. And if there's something abnormal being felt, contacting your primary care provider is strongly recommended.
Men are reluctant to seek help when it comes to their health care, aren't they?
Yes, they are. Part of me thinks that's because oftentimes men aren't having symptoms. We mentioned testicular cancer. Almost always those lumps are painless. Prostate cancer, when the screening is done for patients, depending on their risk factors, again, very rarely do they have symptoms. And that's the importance of screening, because we want patients to, look and have these things caught early. We mentioned prostate cancer, men, depending on their risk factors, should have screening done a little bit, more rigorously based on those risk factors, specifically family history of prostate cancer, or a family history of breast, ovarian, or pancreatic cancer. We know that's a cousin of the type of cancer, an adenocarcinoma. So again, not just prostate cancer, but breast, ovarian, and pancreatic are important. And then race. It's been shown that African Americans unfortunately have twofold the risk of prostate cancer when compared to the rest of the population. And 1 in 8 men are diagnosed with prostate cancer in their lives.
Real quickly, focusing on the mental health piece of it, what should folks be watching out for? Both men and the people in their lives, right?
Absolutely. Any concern or any change in mood or excitement is something that used to make other men make them excited, should be looked out for, specifically by the patient or even by a loved one or a friend. If they look less engaged in something that they used to have a lot of passion for, ask them about them, talk to them about that.
Excellent. All right, we'll put links to the websites you mentioned on ours, 13onyourside.com. Thanks, Dr. Tobert.
Thank you.